Kia ora koutou katoa. Good afternoon, everyone. Today, I will set out a little bit about what the case numbers are telling us about the spread of the virus currently, and also touch on the support services available to New Zealanders who may be struggling while we're in lockdown. But first, I'll pass over to Dr. Ashley Bloomfield to update us on the case numbers.
Thank you, Prime Minister. Kia ora koutou katoa. So today we're reporting 83 new community cases since 9 a.m. yesterday, taking our total number of confirmed cases associated with the current Auckland community outbreak to 511. 82 of the new cases are in Auckland, one is in Wellington. The latter is a close contact of an existing case and was in isolation with no exposure in the community while infectious. There are also 2 new cases to report in recent returnees in managed isolation. So the total number of community cases in Auckland is now 496, and it is 15 in Wellington. 453 of the cases to date are epidemiologically linked, with the remaining 58 links being established epidemiologically and through our ongoing genome sequencing. There are currently 7 subclasses identified within the outbreak, the 2 largest being the ones we've talked about previously, the Birkdale Social Network, associated with Case A that has 68 confirmed cases now, and the Mangere Church Cluster that has 237 confirmed cases. All of the remaining clusters have fewer than 20 people associated with them. Now, at the moment, we have 34 people in hospital as a result of this community outbreak. 32 are in a stable condition on a ward, while 2 are in a stable condition in intensive care. 3 of those cases are in North Shore Hospital, 18 in Middlemore Hospital, 13 in Auckland City Hospital, while 1 is in Wellington Regional Hospital. And just to reinforce that there are appropriate isolation and infection prevention control plans in place at all hospitals where COVID-positive patients are being managed. Locations of interest were 475 as at 9 o'clock this morning, and additional locations that continue to be identified will be put up on our website. So please do keep checking regularly. We are now removing locations of interest from the website after 18 days, because after that time we're not concerned about ongoing transmission or public health risk. Because we are in Alert Level 4, but it does emphasise the importance of everybody to adhere to those Alert Level 4 requirements. A reminder, anyone who's been at a location of interest, self-isolate within your family bubble or your home bubble and call Healthline for advice on testing. As you call Healthline for advice on testing, rather than just going out to get a test, that assists us because your contact details will then be entered into our contact tracing system. And we can trace and track your swab more quickly through the laboratories. Now, on contact tracing, an update on the numbers there. As of 10 a.m. this morning, there were 32,771 individual contacts that have been formally identified. Of these, 26,473, around 80% have been followed up formally by our contact tracers. And around 85% of all contacts identified have had a test to date. Of course, there's ongoing work to follow up the remaining contacts, many of whom, if not most, have had contact already with the system through Healthline. We continue to increase our contact tracing workforce, and as of this morning, there are over 1,700 contact tracers trained and available to do not just the initial calls, but all the follow-up, daily follow-up with our very many close contacts. And just some of the contact tracing metrics, which I have here for you. Yes, so there are a total of 784 what we call very close contacts. Of those, 88% have had formal outgoing contact. The balance will have been added to the system just recently. 78% of those we have results back from the lab on. There are 29,560 close contacts. 83% of those have been spoken with, and 85% have a result in the system. Yesterday was another big day on the testing front with 23,139 swabs processed. That seems like a small number, but it is as high as the biggest days we had last August in our outbreak. There has been a decrease in testing over recent days, but there are many people who are coming up for who are close contacts in isolation who will be coming up for their day 12 test. And just a reminder to those people not to go in early and make sure that you do get that day 12 test on day 12. Over 9,700 swabs taken yesterday across Tamaki Makaurau, including about a third of those in general practice. The proportion that are done in general practice drops over the weekend when fewer centres are open. There are still 26 community testing centres open across Auckland today, so plenty of opportunity for people if they are symptomatic or if they are due a follow-up test to go and have that done today. To help speed up process at testing centres, as we've said before, you can access your NHI number if you don't have it already by calling 0800 855 066. We have operators there who can help you get your NHI number. Whole genome sequencing, ESR have run this now on samples from 343 of the cases, and analysis of all those samples that has been successful, which is the vast majority, has shown they are all linked to our current community outbreak. On wastewater testing, no new unexpected detections to date. Following detection of the virus in samples collected in Christchurch on the 21st, 23rd and 25th of August, there were samples collected from 5 different sites in Christchurch on the 26th. Those have all now returned negative results. And there are a number of samples being collected today and tomorrow from 9 sites across Christchurch to help just give us more confirmation that there is no further positive testing results for the virus in wastewater there. The virus was found in a sample collected in Warkworth on the 27th of August, following earlier detections there. It's consistent with there being positive cases in the community at that time, but it is important that anyone in the Warkworth area with symptoms does please go and get tested. I understand there's quite a lot of interest in exposure events or places in Warkworth. None of the places there are listed as locations of interest because everybody who was at those places has been able to be followed up and tracked. But just for your interest, they are the Amberley Rest Home, which is already in the public domain. And I can say that of the people in that facility who were in the dementia ward where the worker worked there, all of those have returned negative tests so far, which is great. The other 2 places were a medical centre in Warkworth, but again, anyone who was at the centre at a time when they may have been exposed has been followed up. And finally, Southern Paprika, a large workplace. Again, all those who may have been exposed there have been followed up. So there is a difference between our exposure events, which we have many, many more than actually locations of interest, and where there's not a need to actually publicise those because everybody can be followed up, they don't become a location of interest. As you see, we already have 475 locations of interest. Ongoing wastewater testing is occurring. 125 locations so far in this outbreak have been analysed, including 86 in the North Island and 39 in the South Island. Finally, before I hand back to the PM, I would like to give a shout out to the hundreds of thousands of essential workers across the motu and those New Zealanders who are going above and beyond to support all of us to stay in Alert Level 4. I've heard of countless examples of New Zealanders selflessly looking out for others in their community, and a particular tribute today to IHC's IDEA Services support workers who are supporting people to stay safe and feel safe and comfortable and stay in touch with their whānau and friends who can't visit during Alert Level 4. So a big shout out to IHC's Jasmine, Dawn, Sandra, Smiljana, Mia, Inderjeet and Ravinda and all their teams for their amazing work. The stories are quite humbling and moving. They're doing this all on top of juggling their own whānau demands and requirements and often working extra hours to keep people safe and reassured. So thank you to them and all our essential workers. Finally, we've gone hard and early in this outbreak and with our public health response, as we have done previously. It is paying dividends, but the public health teams and our health system can't do it alone. As always, together we will make a difference, and Alert Level 4 is something that we can all contribute to, so please continue to do your bit. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. A quick reflection then on the cases that were reported yesterday. More than 3/4 of our cases yesterday were contacts of known cases. And if we break that down further, over half of our total cases yesterday were in fact household cases. This once again shows how infectious Delta is. Only 2 were considered to be infectious before Level 4 restrictions came into force, which is helpful. We know that limits down the amount of contact our new cases are having with others. A total of 25 people had exposure events outside of the household. We're being advised to date that the Ministry of Health analysis is showing that these are generally essential work sites and tend not to be customer-facing sites. We've asked for further analysis as to the nature of these workplaces so we can assess whether our Level 4 rules on who is operating is being adhered to and whether our public health protocols for those businesses that are operating are fit for purpose. As you will have heard me say at the end of last week, we have a small number of workplaces that are operating at Level 4 that have seen transmission within staff. I'm advised that it's 4 in total to date. Now, this may not be a problem with the rules, say, on the factory floor, but what is happening perhaps before and after shifts or even during break times. We're looking at all of this in more detail. If we need to tighten up our restrictions further, we will. You'll also recall that last week we talked about locations of interest generally and the number that have actually produced cases. You'll see that we have now more than 450 sites. And these have started slowing down dramatically as a result of the lockdown and people staying at home. But of these locations, we can share that we believe transmission occurred at 21 of them. For the most part, that transmission has been relatively limited. But our ask would be that all contacts, no matter what the location of interest, continue to follow the public health advice. And many will be coming up, for instance, for a day 12 test. As you'll know, there are 2 particular sites where we know a large number of cases have come from. Well, one, as we all know, is the event attached to the Assembly of God. The other we'd like people to be especially mindful of is AUT. This is a difficult location to contact trace, but we do know it has resulted in 20 cases thus far. Please, if you're connected to AUT, look up the locations of interest for this site and follow the public health advice. And it clearly sets out the different parts of the campus that we're particularly mindful of and we need people to come forward for testing. Before we open up for questions today, I want to talk very briefly about the impact of COVID on everyone. Having positive cases in our communities, along with the impact of lockdowns, I know can be hugely unsettling. And that uncertainty can impact on everyone's mental health. It's okay to feel overwhelmed, to feel upset, or even to feel frustrated, because this situation is often all of those things. But there are places you can go for support and help, even while you're living with restrictions. The Ministry of Health and Unite Against COVID websites have a great list of free resources. These include tools targeted at young people who may be finding this time challenging, in particular those isolating in hostels or halls of residence. We know, for instance, that early on in the lockdown there was a spike in calls to Youthline. We responded to that spike in calls with an immediate $275,000 of funding for Youthline, a boost to what they usually receive. But we want to make sure all of our services in this area are well supported. So we'll be providing an additional $1 million into existing contracts and services to support our rangatahi, with a particular focus on those in Auckland and Northland. A quick recap on some of the helplines. At any time, anyone can call 1737. It's available 24/7 via free call or text. And Youthline, which you can reach by calling 0800 376 633 or by free texting 234. There is also targeted mental health support available to Pacific communities via a dedicated 0800 number. 0800 Olalele, 0800 652 535. Family violence and sexual violence services are considered essential services and are continuing to operate at level 4. If you feel you're in an unsafe environment, you do not need to stay in your home or in your bubble. I'm going to repeat that. If you are not safe at home, you can leave your bubble. If you feel in danger, call 111. If you or someone you know is in danger and it is not safe to talk, police have the silent solution. Phone 111, and if you do not speak, you'll get the option of pressing 55. You can then listen carefully to the call taker's questions and instructions so they can arrange assistance for you. There is also support in place for those struggling to access food. In addition to the $32 million we invested last year into food banks, food rescue, and community groups that are distributing food to vulnerable people in whānau, yesterday we announced an additional $7 million for food security networks operating at Alert Level 4. The extra funding will help with the distribution of an additional 60,000 food parcels and 10,000 wellbeing packs. If you're unable to afford food, call MSD on 0800 559 009 to see if you are eligible for assistance or to be connected to other forms of assistance that is available. If you're at home isolating or having problems accessing food, you can ask family, friends, neighbours if they can help deliver food for you. Delivery should be contactless and kept local. For those in self-isolation or have no other way to access food, the Student Volunteer Army also has a grocery delivery service. Visit www.shop.sva.org.nz. We continue to support those needing emergency housing during the lockdown also. Since lockdown began on the 18th of August, we've contracted more motel units to cater for people who would otherwise be sleeping rough, and we're closely monitoring this need. You might have heard me mention last week as well, the 3 Auckland Metro DHBs are vaccinating those who are homeless via a range of mechanisms, including Auckland City Missions GP Clinic, a mobile outreach team, and we're working with homeless providers to visit temporary housing sites and provide transport to people in temporary housing to enable them to reach vaccination centres. What I've listed really is just a snapshot of the various supports in place to help everyone get through this period of restrictions as we tackle COVID-19. And I guess I would summarise it as follows. You are not alone. We are all in this together, and support really is just a phone call away. Those key numbers again. For food, MSD, 0800 559 009. Mental health support or counselling, call 1737 or Youthline on 0800 376 633. If you're from the Pacific community and need mental health support, 0800 652 535. Please do make use of these services. They're there to support you. We'll now take questions. Mikey.
Prime Minister, we've seen an extra 9 people in hospital. How concerning is that?
Of course, deeply concerning, and it's the whole reason that we've taken the actions that we have. We know that Delta is both more infectious, but we do and are seeing studies that are telling us that it is more dangerous. And unfortunately, we're seeing that in our hospitalisations. It's another reason we need everyone to act and behave as if they may have COVID and to act and behave carefully.
Yesterday, around 40% of those numbers in hospital were under the age of 40. What do we know about, what that younger demographic are going through, especially those who are in hospital?
Well, I think in part this reflects the fact that we've got a significant proportion of our cases are under 30, over 60% are under 30. However, we have seen this in other countries with Delta outbreaks, including across the Tasman, that they have ended up with a much higher proportion of their people hospitalised being those younger people, and many of them without pre-existing conditions. You know, COVID can be a serious illness for anybody, no matter how well they are or not, before they get the infection. At the moment, the hospitalisation rate is between 6 and 7%, a little higher than we may have seen in the past, but the important thing here is that our hospitals have got capacity and they are geared up to look after these people if they need hospital care.
I think also it's another argument for, yes, everyone following the level 4 restrictions, please stay at home, but also please get vaccinated. We know the very high success rate of the vaccine that we have free and available in New Zealand at preventing serious illness and hospitalisation. It's the best thing you can do to protect yourself and others. Jenna, and then I'll come over.
With the case numbers over 80 again, this is starting to look more and more like our first lockdown. Are you confident that we're starting to level off, or are you expecting the case numbers to continue to grow?
I actually don't think it's like our first lockdown, in the sense that when we first went into that lockdown, a real unknown as to how many cases we really had in the community. And I would wager that the cases that we were reporting would have been an underestimate. Our levels of testing at that stage, not nearly the levels of testing that we have now, but also COVID was different. This is a variant that is much more fast-moving, much more infectious, and therefore we need to be more vigilant than we have been before. But that's my assessment.
Yes, just to add to that, it's quite clear because we've seen some historical cases since that first outbreak last year in March and April. It's quite clear that we didn't pick up all the cases then. We were only testing 2,000 to 3,000 people a day, much higher rates of testing. And likewise, the infections were spread right around the country, whereas this time it's very focused in Auckland. In terms of whether we are making progress, the latest modelling I've seen suggests, look, we are getting our effective R rate just below 1, and we need to get it even lower. And so the key question, of course, is level 4 working and doing what it was intended to do? Absolutely. The only way that we will continue to get that trajectory now to start turning and coming down is if people keep doing, as they did last year, what they need to do in alert level 4. That's fundamental to our success here.
Prime Minister, on Friday you indicated that Auckland would be in the level 4 for 2 weeks. Can you just talk through what Cabinet will be discussing and deciding tomorrow? Is it likely just to be confirmations there?
Yeah, so tomorrow we will be discussing the advice from our health experts. You know, they gave us an early indication of what they thought would be necessary. My expectation is that they'll be using the most up-to-date information, the most up-to-date modelling, and of course confirming, all that we're seeing across the country as well around some of those other decisions around level 3 being the right call at the right time. But we wanted to let the public know what we were being advised as early as we could. And then we'll come out tomorrow and confirm what decision we've made.
We're going to break away from the news conference now, but you can keep watching on our website, newshub.co.nz. Just recapping those key points from the press conference there. There are 83 new cases in the community in New Zealand today. That breaks down as 82 in Auckland and 1 in Wellington, who is a household contact. That takes our total of community cases in this outbreak to 511 all up. There are 34 people in hospital, including 1 in Wellington, and 2 of those people are in intensive care. Locations of interest are now to be removed from the website after they've been there for 18 days. Looking at the clusters now, the Assembly of God Church of Samoa in Mangere is still the largest with 237 cases. The second biggest is the Birkdale Social Group with 68. And as far as testing goes, there were 23,139 swabs processed yesterday, and there have been 4 transmissions at workplaces since we moved into Alert Level 4. I'll be back at 6 p.m. with the latest and a full wrap of the day's developments. I'm Tom McRae. Good afternoon.